Hi, Rosa. Thanks for being here with me today.
Thanks for having me.
No problem. So we're going to dive into screening and assessments. What does screening and assessment mean in the world of community health workers?
So screening and assessment are sometimes used interchangeably, but for a CHW, they can think of them as tools for the trade. And so a CHW may not always use a screening tool, maybe more of an assessment tool. And so the difference of a screening tool and assessment tool is that for screening, you can think of it as evaluating the suitability for something. So for example, you're doing a depression screening to determine if it may be appropriate to submit a referral for mental health services. For an assessment, you are more determining whether something or somebody needs something. So you're talking about, probably the most common one would be a needs assessment. You're going into a lot of different factors. So maybe you're assessing housing, you're assessing employment, and other things that may be needed for that client.
Are there difficulties with doing screening and assessments?
It can be difficult if you're going into sensitive questions. So even demographic questions, which may seem simple, if you're asking somebody for their social security number or even their home address, that can sometimes bring up some hesitancy to respond. And if you are also asking questions regarding, their mental health status, even employment or substance abuse, those can be very difficult for somebody to answer.
How can a community health worker get around those difficulties?
The best way is to build that rapport, which really means building trust. It's making sure that the person that you are engaging with knows why you are asking those questions, what the purpose of that is, what your role is in all of this, and really just taking the time to making them feel comfortable and encouraging them that if they at any point not are comfortable answering, that it's okay not to. And so it may be that this relationship is built over time.
That's great to know. Thank you so much for being with me here today, Rosa.